Hi, I'm Dr. Bill Wyatt, and I'm a general dentist, and I've done nothing but orthodontics since 1970. Uh, I'm a member of the American Orthodontic Society. This is a group of general and pediatric dentists that our main purpose is teaching other general and pediatric dentists how to do orthodontics properly. And we work with them in any way we can in helping them do this. We have a wonderful organization. We have a good journal. We also have a board that if you pass the board of the American Orthodontic Society, you certainly know how to do orthodontics. You don't do that in a couple of weekends either, so it takes a while to do. And you have a good organization to be at. We have a good annual meeting, several other meetings during the year, a whole group of really sharp instructors that teach you from the ground up. So I hope if you're doing orthodontics as a general pediatric dentist or any other dentist, we don't care, just uh, be a member of this organization. Today I'm going to talk about Electrosurge in orthodontics. This is maybe a minor part of it, but it's an important part. And I've tried lots of different types of lasers and everything, but it seems like Electrosurge is the best thing going as far as taking tissue off of, say, partially impacted second molars or wisdom teeth, so that you could get a band on them, or so that you could get a bracket on, or a tube to set up an uprighting spring, or there's all kind of cases where you have to use electrosurge. So I just want to pass on a few things about electrosurges and how you can do this. I'm going to go back over here and have to tap this little button so that it'll work over on this side. This Elman Electrosurge is one. There are several other kinds. I'm not pushing any particular kind. This is the kind I've had for years, and it's adequate, works good. And I'm going to show you a few things about this type of Electrosurge. I think it's really all you need, and it's a lot cheaper than the lasers. The lasers are good for certain things, but they're just too slow for doing the electrosurge work that we do. The Elman comes out with a little tip that's really quite good. It has a plastic part down here, and then this little wire, which is platinum, I think, comes out, and you can bend it however you want to, or you can have it short if you want to do that. You have it chipped off like that. It works, and that's about the only one. I do use a cauterizing kind of a button they have for cauterizing, where you're uncovering you've got an impacted cuspid down in a hole, and you've uncovered that tooth down there, and you want to go in and bond something to it, so you have to stop the bleeding and the weeping of the tissue and dry it off and etch it and everything. Then you can go down and attach a bracket to that tooth. And that is one way of doing that. We'll show you other ways. Now, I'm going to go to the, well, here it explains the different tips and things, and when you get it, it's really all you need as far as uncovering, taking tissue off. You'll get a kid that's on dilatant, and the gum tissue will be just growing and piling up around the base of the tooth. You can take this and go around, just trim the gum tissue off, and it kind of cauterizes, doesn't bleed, and heals up nice. So we do that on some of the cases. Or if gingival tissue is in the way and needs to be trimmed back, you can do it with these things. That's a good part of orthodontics. So if you are doing orthodontics and don't have one, it's advisable to get one. You just can't do some of the things with it. Here is a little platinum wire that's on a mirror, and you can bend it at whatever shape you want to. Sometimes we go out and make a little curl at the end if you want to cauterize with it, but most of the time we'll use a little round, kind of comes out like that and has a little round knob-like thing, and we cauterize the tissue around cuspids and things we've uncovered. We want to cauterize and dry up so we can bond down in a hole, more or less. This is good use of these things. I just wouldn't want to practice without a electrosurge. Now you can use lasers if you want to, but when you really get in there to trimming on it, I just can't do it much more efficiently and everything with one of these. We bend this wire, you see, and go in and trim the tissue around the tooth we want to put a band on. Here's a second year molar coming in, and I really need a band on this tooth with a real solid bracket. And this is a mirror stuck in the mouth. This is a separator that's been in there. It's got space enough to put the band on. So we're going to just go in and inject around this, just infiltrate around it. And we'll curve that wire and go in over here and just trim it like such. And this mirror is just showing you the side. Actually, these are the teeth right here. This is a mirror that you're looking into right over this side, just a mirror. Let me erase all that. You can kind of see the edge of the mirror, and we take a lot of photography through mirrors like that. You just almost have to. Here's another view of the same thing, same difference. This is the structure right here, and this is the mirror we're shooting straight into. It gives you a good shot of the tooth. Now we're going to come in and trim this tissue off, get it out of the way here where we can get a band on this tooth. You think, well, that's ridiculous putting a band on. Sometimes you really need one. It's another view of the same thing, so you can see what you can do with these. Now, I took enough views of it, looks like, here, but it looks like after it's healed. Now here it is right after we've cut it. And here's your mirror over here. And we're just trim that with that curved wire, you see, goes in, and you can take this little chunk of tissue out. There'll be very little bleeding, and then we go right in and put the band on the tooth. If you want to trim tissue, otherwise you can just do all sorts of tissue trimming with that. Now that's the separator that we've got in there. Now there's another view of it after we have trimmed it, and now we come in and see the band, and we're showing the mirror shot gives you a better view of that, and we're able to see the band like that, and you think, God, dog, that's tough stuff, but you can. Now sometimes when you really need a bracket to hold in a certain area, it's better to put a band. And you can do this. This heals up quite well, and you don't have very little trouble. It's just tedious work. Orthodontics, good orthodontics is going to be tedious, hard work to do. Let's see. I think we erased all that. There it is from another view with the band on the tooth. Here's a young lady that we banded that tooth. She had a impacted cuspid. It's hard to see, and you see the cuspid up in here, and that's a baby cuspid. We've got it marked up here for you so you can see the permanent cuspid down in this hole right in there. Now we want to go in and we'll open this up and go in and bond onto this cuspid crown in here and extract this tooth. And you want to have everything ready to go when you do this. And so you can start pulling that tooth down into that opening right there. Here is another case that we have of an impacted cuspid, and it's this is really, well, that's after we did that other tooth there. The tooth is down in place now in there, and we still have one wisdom tooth. We'll just leave it alone, but we've extracted wisdom teeth over here, and I'm not sure on this side up here whether we extracted one or not. Now we cover impactions under details, so this is not very detailed. You can't look at this and figure out how in the world we've got all this rigged up. But this is a spring right in here that's going from tooth to tooth, opening up the gap in here. This is a spring attached to the molar back here, and it came up to about here. We put this floss on it, and we stretch it out to here, goes up through this little circle, goes up to the tooth, is attached to the tooth right there. This arch wire is made coming out with this little circle in it like that. So wherever you want the tooth to go, you build a little circle in it. Then you can twist the spring on just a single spring in the gap and be opening the teeth at the same time as you're pulling this tooth down right up here. That's complicated. That's pretty hard to see right here, but if you go back to those impacted teeth, I'll go in detail showing you how to rig this up. This will pull in almost any impaction you can come up with. We've used it all sorts of ways, and put a steady pull on that tooth, bringing it down. You can also come off of here while they're wearing it, wear an elastic over here and go put the elastic. Excuse me, the patient has to hook the elastic. The patient doesn't do anything to it, and it'll be pull the tooth right down in the mouth. And that's about all we're going to show. There's a lot of more things that you can do with electrosurge. You can see this pull that tooth right down here, and we put a bracket on it. Bracketed, that's no big deal. Impactions, we can handle most all of them. Here's the young man, and there's the impacted tooth that we started out with right there. Excuse me. Sorry for that pause. I got something hung in my throat here, dried up or something. All right, this is another just impacted case, where you'll go in and just uncover a tooth like that, uncover over here and bond something on them, and then we rig up the thing to pull the tooth down in that spot, be open in the spot at the same time. You can pick that up on impacted teeth. It's hard to see it here, but I had to show it, just showing you uncovering there those same teeth. And we don't show much in between, but that is the same person right there. And we pull those teeth in and finish it up. And when you get through with it, this is of course the deciduous tooth in this area right here. We're going to bring a tooth in there. Over here, we got to open this up and line that tooth up better there. Now here's what it looks like in the palate. I think an old surgeon did this one, but I like to cut a smaller hole. Boy, they go in and make a great big old place, and it leaves very little scar at all in there. It's coming in. You can cut tissue off the palate, but don't take it off the labial up here. And now we've got this spring in here expanding the case, and we'll rig this spring up on the side back here to come in and pull that over to that spot. That's not very clear, but that's kind of what we do with the electrosurge. We go in and uncover that. And there the tooth is in, and you can see there's very little evidence bringing that over like that. The palate clears out good. This has a elastic around this tooth on the other side. And that concludes our part on electrosurge. But if you do much orthodontics at all, you should either have a good laser or an electrosurge. I personally prefer the electrosurge, and if you want to have a laser also for doing more delicate, slower things, but the electrosurge is just really adequate for uncovering tissue and stuff, uncovering teeth, but checking off tissue in orthodontics. So I don't think you have to have anything other than electrosurge just to do orthodontics. So that will conclude our deal here on electrosurge, and I'll close this out now.